Okay, I'm going to walk you through diaphragmatic breathing. The goal of this video is just to have a good understanding of what you should try to feel during your diaphragmatic breathing exercise and things to avoid doing, so that way you're utilizing the diaphragmatic breath to either relax the pelvic floor or maybe even relax the muscles around your neck if you're experiencing neck pain or jaw pain, or if you're looking for like a nervous system reset to stimulate your vagus nerve to help kind of calm you down and get you out of that fight or flight response. So the most important thing is that during your diaphragmatic breaths, you're really focused on nasal breathing. The inhale going in through the nose and then either out through the nose or out through the mouth. We want to keep the shoulders relaxed and we want to keep the neck relaxed. What we don't want is we don't want to feel that we're taking a deep breath and then there's this big chest rise, because that is not very relaxing and it's very similar to how you would breathe if you were in a very stressful situation. So we don't want our diaphragmatic breath to feel like there's a lot of chest rise. So neck and shoulders stay relaxed. And we want to almost feel like we're grounding our body to the earth. The next thing you want to focus on is we want to feel some body expansion. So there's going to be a little bit of a chest and belly expansion. So it's not a rise where it's going up, but it's more like it's expanding forward. And we're going to have some expansion of the side of the ribs, and then we're going to have a little bit of back expansion too. So think about we're trying to take a 360-degree breath, very circular, or like an umbrella that's trying to open and expand all the way. And then when we're breathing out, the umbrella closes too, okay? And so when you're doing is sitting, the most important thing is just finding that comfortable position so that you can really focus on relaxing the right parts of the body and expansion of the right parts of the body too. Outside of there is that I really encourage you to, instead of thinking about trying to take this really large belly breath, where I feel like I'm actually working really hard, you should really focus a little bit more on just actually extending the time in which you're taking that breath, which may be a little bit difficult for some people who are used to breathing those kind of smaller, more shallow breaths too. So build your way up. Try to shoot for a goal of inhaling in through the nose for about 5 seconds. And then exhaling out through the nose or the mouth, as long as everything stays relaxed, for at least an equal amount of time. If you can go a little longer than your inhale, great. But the goal is making your inhale and exhale at least equal in length of time, and then working away and extending that time to at least 5 seconds. And building your way up. So it should still feel very comfortable when you're breathing in through your nose and you're trying to extend that time. But the goal and the focus is just slowing down your breathing to allow the body to actually feel the expansion and the pressure change. I'm going to show you lying down. So when we're laying down, and I would like for you to try to find at least once a day time to lay down for about 3 minutes up to 10 minutes, depending on how wired your body might feel, how tight you may feel, or maybe if you're feeling pelvic discomfort, you may want to do it for a little bit longer. So once a day for several minutes, you're just going to lay down, get comfortable, maybe get some pillows to support your leg, and you can even do this in bed. You just want to make sure that when you lay down, you try as best as possible to get your back flat so that there's not a huge arch that's pushing your ribs up. That way your diaphragm just has the opportunity to just do its job passively. So in this position, you're going to just breathe in through your nose and then out through the nose or mouth. And during this time, all I want you to focus on is just feeling your body stay relaxed, feeling for that expansion on the inhale, and then feeling how everything shrinks back down as you're exhaling. You may even been able to feel what's happening down into your pelvis. Inhale, feel the pelvis lengthen and expand. And then you're going to exhale, feel the pelvis recoil in a very gentle contraction with your exhale. Inhale, expand and open. Exhale, gently closing in. So during that time, you just focus on slowing down your breathing, letting the abdominals relax, and just kind of feeling that body expansion for your diaphragmatic breaths. So hopefully you found that helpful in guiding you on what you should be feeling when you're doing your diaphragmatic breathing. And then what can be helpful are those hourly tone checks where you're taking 5 or 6 just breaths where you're allowing yourself to slow down so that you can relax your body and your pelvic floor, especially if you're feeling tension and pain. So hopefully you found that helpful. Have a great day.